You are on the front lines of patient recovery. You see how the body moves, how it responds to stress, where its limits are. This is especially true when working with patients who have heart and lung conditions. Let's dive into some of the most common cardiac medications you'll encounter. First up, beta blockers, olol drugs, metoprolol, atenolol. They block adrenaline's effects on the heart. This slows heart rate and reduces contraction force, lowering blood pressure. Key PT takeaway: blunted heart rate response. Heart rate won't climb as high or as fast during exercise. Don't rely on HR alone. Use the RPE scale. Watch breathing rate. Watch general fatigue. Next, ACE inhibitors, pril drugs, lisinopril, enalapril. They relax veins and arteries to lower blood pressure. They block formation of angiotensin II. A persistent dry cough is a well-known side effect. That cough can limit exercise and deep breaths. Serious but rare. Angioedema, facial, tongue, or throat swelling. Also, postural hypotension. Be careful on standing. Diuretics, water pills. Example, furosemide. Lasix. Example, hydrochlorothiazide. They remove excess salt and water, reducing blood volume and blood pressure. Useful for heart failure and edema. Risks: dehydration and low potassium, cramping, weakness, fatigue, arrhythmias. Finally, anticoagulants, blood thinners. Examples: warfarin, coumadin, apixaban, Eliquis. They prevent blood clots from forming or growing. Important for atrial fibrillation and deep vein thrombosis. PT concern: increased bleeding and bruising. Even minor bumps matter. Be careful with manual therapy and during gait training. Eliminate fall hazards in the environment. Watch for internal bleeding signs, unusual joint pain, swelling, unexplained bruising. When we shift our focus to the lungs, a few key drug classes are essential for you to know. The most common are bronchodilators. They open the bronchi and bronchioles, making it easier to breathe. A common type is the short-acting beta agonist, or SABA, like albuterol. Quick relief but possible tremors, nervousness, and tachycardia. Ensure prescribed pre-exercise use and monitor heart rate. Corticosteroids reduce airway inflammation, inhaled like fluticasone, or oral like prednisone. They don't give immediate relief, they're for long-term control. Long-term oral steroids can cause muscle wasting, osteoporosis, thinning skin, and elevated blood sugar. Be mindful, prioritize resistance training to combat myopathy and use strategies to prevent fractures. Inhaled corticosteroids act locally with fewer systemic effects, but can cause thrush. Remind patients to rinse after use. With long-term oral steroids, use gentle manual techniques, avoid high-impact activities. No rescue versus controller meds. Frequent rescue use is a red flag. Communicate increased rescue use so the plan can be adjusted. Your clinic is a real-world laboratory for observing medication effects under stress. Start with vigilant monitoring before exercise. Always take baseline vital signs. Blood pressure, heart rate, oxygen saturation. Use them to set a safe range and watch continuously during the session. Use RPE, especially with beta blockers that blunt heart rate. Ask how they feel: lightheaded, dizzy, unusually fatigued. Subjective reports matter as much as the numbers. Watch breathing patterns and accessory muscle use. Differentiate normal exercise intolerance from adverse drug reactions, red flags, chest pain, palpitations, sudden severe headache, or confusion. On anticoagulants, a painful swollen joint after a minor stumble may mean internal bleeding. On ACE inhibitors, sudden facial swelling is a medical emergency. Stop the session and initiate the appropriate response by contacting their doctor or calling 911. Document vitals before, during, and after exercise, plus symptoms and signs. Note patterns like orthostatic drops or increasing cramps. Share findings with the physician to inform medication adjustments. Your communication leads to safer, more effective outcomes. Integrate pharmacology into the evaluation. Get the list. Ask what each drug is for. Use a drug reference and educate. Build a clinical picture and anticipate side effects. Create a clinic cheat sheet with mechanisms and key PT considerations. Share with colleagues. Communicate openly. Collaborate widely. Adapt plans and educate. It's the hallmark of an exceptional physical therapist.